People assume medical progress is clean, careful, controlled, safe. It isn't. In the late 1800s, one doctor crossed a line so extreme that modern medicine tried to forget his name. He injected dying cancer patients with live bacteria, not by accident, on purpose. And what happened next terrified everyone. Some patients got worse, fast, violent fevers, organ failure, death. But others, against all logic, got better. Tumors shrank. Cancer vanished. Patients who were supposed to die walked out alive. His name was William Coley, and for decades, doctors argued over a single question: was he a pioneer or a killer? Coley had noticed something no one could explain. Cancer patients who caught severe infections sometimes survived longer. Sometimes the cancer disappeared entirely. So he did what no one else would dare. He weaponized infection. He injected patients with bacterial toxins to force the immune system into full-scale war. The idea was brutal, crude, and wildly unpredictable. Sometimes it worked. Sometimes it killed the patient faster than the cancer ever would have. There were no safety protocols, no standardized doses, no clinical trials, just hope and horror. As medicine advanced, the world turned on him. Doctors called the treatment reckless, unscientific, too dangerous to continue. By the mid-1900s, Coley's work was erased from mainstream medicine. Case closed, or so it seemed. Because something strange happened next. Decades later, cancer researchers made a discovery that forced them to confront an uncomfortable truth. The immune system, if activated the right way, could destroy cancer on its own. Not with poison, not with radiation, but with precision. Modern immunotherapy was born. Checkpoint inhibitors, CAR T cells, treatments that now save millions of lives every year. And at the foundation of it all was the same terrifying idea Coley had a century earlier: use the immune system as the weapon. Coley never lived to see it. His patients died before science caught up to his intuition. But history eventually rendered its verdict. The treatment that once killed patients became the blueprint for therapies that now save millions. Progress doesn't always look heroic. Sometimes it looks like failure. Sometimes it looks like controversy. And sometimes it looks like a mistake that was simply 100 years too early.